Good afternoon. I'm going to share my screen. There we go. Good afternoon and welcome to today's presentation, the nuts and bolts of MIPS scoring improvement activities. My name is Kaylin Henderson and I will be your facilitator today. At this time, all attendee lines are muted for this session to minimize background noise and distractions. We encourage your questions and input throughout this presentation, so please feel free to use the raise hand icon in your taskbar or submit questions and comments in the chat box provided. Today's presentation will include interactive polling questions. In addition to our presenter has provided a copy of today's slide deck. You'll find this copy noted as handouts also included in your taskbar. Today's presentation is being recorded and later uploaded to our HealthVisions Delmarva PTN YouTube channel. We ask everyone to visit this channel simply by going to YouTube and searching HealthVisions Delmarva PTN. You can also subscribe to this channel and even get post notifications as we upload more content. Now, for those of you who are joining us again in sequence of last week's nuts and bolts quality measures, welcome back to part 2, improvement activities. And for those of you who have missed last week's presentation, you may find a recording of that presentation on our YouTube channel. And we'd like to thank everyone for joining us. Cindy Eisen, EMBA Project Manager for HealthVisions Delmarva, will be our presenter today. And for those of you who may not know Cindy, she has over 30 years of experience in healthcare, starting in the area of health information management and expanding her skills in areas of expertise to performance improvement, operations management, healthcare financing, and practice transformation. Cindy has been a CEO, COO, and Regional Quality and Operations Director with HealthSouth, Kindred, and several community hospitals. And Cindy is a native of Pittsburgh, a graduate of the University of Pittsburgh and the Troy University in Alabama. And now, Cindy, I'd like to pass the presentation over to you. Okay. Okay. So, welcome everybody. Glad you could join us today. For those of you who are returning, I hope that the information you got last week on quality measures was helpful, and I hope that the information we're able to share this week on improvement activities is equally helpful. Let me hide my toolbar or not. You can't see it, it doesn't really matter. Okay, so I'm looking at the toolbar over here, guys, and I'm thinking, oh my gosh, they're seeing my toolbar, but you're not. Our learning objectives for today are to understand improvement activities that are part of the MIPS system, and to understand how those activities are scored and how it impacts the total score, and then finally, to try to help you to be able to pick the most appropriate improvement activities for your practice. So our agenda is we're going to do a very brief overview, even briefer than last week, of our MIPS scoring components and eligibility. We're going to look at MIPS improvement activities, the submission methods for those, and then talk a little bit about how to pick the best activities for your practice. We like to have some questions to run on. We want you to be thinking about these things as we're running through this presentation. Some of the questions we would hope to answer for you today are how you can use MIPS improvement activities to improve workflow and efficiency in your office and improve the satisfaction and retention of your staff. How you can use MIPS improvement activities to further improve the clinical outcomes and engagement of your patients. And what tools that are available to you to help make an informed decision about which improvement activities are best for you. So it's time for our first polling question, if you'd like to run that one, Kaylin. Okay, the first polling question is, did you participate in Module 1 of this series focused on quality measures? Just another second. All right, I'm going to go ahead and close that poll, and I'll share the results. So you had 63% said yes, and 37 said no. Okay. So that's good for me to understand where we're coming from and what kind of background that everybody has on the call. It's a pretty good proportion that were on last week.
But just so we're starting on equal footing, if you will, I'm going to do a very, very quick overview of what is MIPS before we get into the improvement activity scoring. So again, what is MIPS? MIPS streamlines the 3 legacy programs of PQRS, meaningful use, and value modifiers into one program. And then it adds a 4th component to promote improvement and innovation in your clinical activities. The MIPS system should allow clinicians, flexibility to choose measures and activities that are meaningful to their practices. In 2017, the MIPS score will be calculated using only 3 of the categories of scoring: quality, improvement activities, and advancing care information. Those will be added together for a final MIPS score. The cost category won't be added until the following year. Each of the categories are weighted, so there's a different weight for each category. Last week we talked about quality measures, which are worth 60% of the score in the 2017 performance year. Today we're going to talk about improvement activities, which will account for 15% of the score in 2017. And next week we'll be talking about advancing care information, which replaces meaningful use and will be responsible for 25% of your score in 2017. These are default weights. The weights could change depending on certain circumstances when things don't apply to a specific specialty or practice, but we'll talk more about those as we move forward. One of the aspects of the MIPS system that was added after the initial rule and into the final rule was a pick your pace participation methodology. Pick your pace allows you to get started in MIPS without experiencing any negative adjustment impact to your payment, but it does recognize the fact that not everybody will be ready full speed ahead at the beginning of 2017. So the first pace that you can use is called a test pace. The test pace means that you have to submit something, anything, just give it a try. It's some data. It's one measure on one patient for quality. It's one improvement activity if you choose to submit an improvement activity, or it's the 4 base advancing care information measures if you choose to submit only those. If you test your pace, you will be guaranteed at least a neutral payment adjustment. In other words, you will not get any negative adjustment to your payment rate in 2019 based on your 2017 performance. You could do a partial year. A partial year means you don't have the ability to submit your data for the full year, but you can submit data in all 3 categories according to the requirements for at least 90 days. The 90 days basically reflects 1/4 of the year. The intent is not that you would not submit in the first quarter, submit in the second quarter, and then not submit in the third and fourth quarters again. It's more of the idea of if you can at least begin submitting in the 4th quarter of 2017 from those 90 days, you would be eligible for partial year consideration, and that could result in a small positive payment adjustment for you. Full year participation is exactly what it says. It's submitting your data for a full year, and you would be eligible for a modest payment adjustment. You would also be eligible, depending on your performance, for additional bonus dollars. Non-participation in the QPP in 2017 will result in a negative 4% payment adjustment in 2019. So I want to stress that. All you need to do is submit one measure in one category to ensure yourself of a neutral payment adjustment. If you elect to do absolutely nothing, not even submit one, you will get a 4% negative payment adjustment in 2019. Test your pace again, really just to explain it a little better. You avoid the 4% penalty, and you only have to submit either one quality measure, one improvement activity, or 4 of the base advancing care information measures. Full year reporting, 90 to 365 days. It's the best way to earn the largest positive payment, and that's to submit data in all the categories in one of those ways, either 365 or 90 days. And positive payment adjustments up to 4% are based on performance rates, not on the amount of information submitted or the length of the reporting period. So it's based on performance, not the amount of data. You do have to decide for all the categories how you're going to report, whether you're going to report as an individual or if your group is going to report as a group. Whatever you pick, you have to do the same thing for your quality measures, your improvement activities, and your advancing care information reporting. It doesn't matter how you bill. Just because you bill as a group under a single TIN, you can still report individual measures for each individual NPI under that TIN. But you can also, if you bill as a group, because you use that TIN as a group, report your data as a group. And each practice will be a little bit different. If you have tremendous variety of performance within your group, and you don't want very high performers to be negatively impacted by an average that takes into account a lot of low performers, you might want to report individually. If you're pretty evenly performing within the practice and the average is pretty close, you know, everybody is pretty close to the average or the mean, if you will, you might want to report as a group because it would be simpler to do it that way than data on each individual. Okay, so now it's time for our first polling question after that short review.
Okay, the first polling question is, are you an active participant in the HealthVisions Delmarva Practice Transformation Network? Option is to choose yes, I have had an assessment and working with your practice advisor. Yes, I'm new and will begin activity with my practice advisor soon. Yes, I am new to the program but have not yet been assessed. Or no, I'm not a participant in HealthVisions Delmarva Practice Transformation Network. Looks like we're pretty steady here, so I'm going to go ahead and close this and I'll share the results. Cindy, we had 49 say yes, they've had an assessment and working with the practice advisors. 10% said that they were new and will begin with their practice advisors shortly. 18% said that they're new to the program and have not yet been assessed. And we actually 23 said that they're not a participant in HealthVisions Delmarva PTN.
Okay. Well, certainly the vast majority are members of the PTN and actively participating, and we're really happy that you've elected to join us and that you're participating with your practice advisor. You're going to see in a minute that that's going to help you with your improvement activities scoring. For those of you who are new, so that's 28 new, if we haven't reached out already to schedule your assessment, we will be doing that very shortly. If you don't hear from us within the next week or so, please do reach back out and we will identify what's going on there and make sure that we're getting to you and we're being responsive to your needs. For those who aren't participating, that could be because you are in an ACO and you can't, or because you just have another role. You're not a practice, you're not managing a practice, and that's fine. We have some capability to accept new practices, depending on the area that they're in and what it is that you want to do. But so if you're not already a participant and you want to reach out, please do so, and we would be happy to talk with you about options. Okay, improvement activities. Improvement activities are worth 15% of your score in performance year 2017. There are 92 of them, and they're grouped into categories that we'll review in a minute. You do have to attest to doing the activities, and each activity must be completed for a minimum of 90 days. These activities are not one and done activities. It's not like it's a project, and so I do this project to, let's say, implement a patient engagement or satisfaction survey. You don't get to just do it once for 90 days and then it goes away. The idea is to spend 90 days creating and conducting your first assessment, your first patient engagement survey, for example, looking at the results and developing an action plan. The intent would be that that would be something that you would then do on an ongoing basis, maybe twice a year, maybe 4 times a year. But it's a permanent improvement. It's a permanent change that you're making to a process within your organization. The maximum score for full credit in this category is 40 points. So that's the most points that you can get in the category. If full credit is earned, 15 points will be added to the MIPS score because it's only worth 15% of the total MIPS score. We'll explain that further in later slides. Points are awarded based on the weight of the activity and the number of clinicians in the practice, location of the practice, and if the clinician is a non-patient facing clinician, and we'll go into that detail. And then finally, activities are weighted as either high or medium. 14 of the 92 activities are weighted as high, and high-weighted activities give you 50 to 100% of your required points for this category. The best way to find the improvement activities is to go out to the qpp.cms.gov website and look them up. All 92 are listed out there. It's the full list of potential activities, and what we want you to think about when you're looking at it are the activities listed meaningful to your practice and population. So I'm going to go off slide for a minute and go out to that website. And you should be seeing the website right now. This is the Quality Payment Program website. It is qpp.cms.gov. That address is on a later slide in attachments. In the Exploring Measures section, and specifically the Improvement Activities tab within that. So I click on that, and it brings up improvement activities. It tells me a little bit about the activities, kind of that slide that we just went over, and then it gives you a search engine. There are 92 activities, as we said. This is listing all of them right now. But let's say we wanted to look for activities in a certain area. Let's say I am pain management is one of the things that my practice deals with. I can type the word pain in, and of course, we'll reload that. Really? Interestingly, I did this morning, and it worked just fine. Thank you. No, this is it. Clear. Let's try one more time and look for something else. All right. I'm not sure why pain didn't work, but there's medication. And I got 8 activities that have to do with medication. This one is implementation of medication management practice improvements. If you click on any one of these, it describes what the activity is. Manage medications to maximize efficiency, effectiveness, and safety could include one or more of the following: reconciling and coordinating medications and providing medication management across transitions of care. So you're transitioning a patient to a different level of care or to a different clinician or group, or integrating a pharmacist into the care team, or conducting periodic structured medication reviews. You can see that this activity is something that it wouldn't be something you would do and then say, oh, I saw improvement, that was great, we're not going to do it anymore. The concept is that you're going to pick activities that you think would be meaningful to your patient population, implement them, and stick with them. This is a medium-weighted activity, so it tells you what weight the activity would have. You can also look at them, and we'll clear this again and reload. We could say we only want to look at the high-weighted activities. That's all I'm interested in right now, is the high-weighted activities. You can see it changed to 14, and it lists for you all 14 of those activities that are high-weighted, that would have the most points available to them. You could look at it by a category. So let's say I only want to look at care coordination. It's 14 activities, and it brings up all of the care coordination activities that you could possibly do. Clear that. And just because I'm difficult, I can't believe I can't find pain now because I searched for them earlier. But generally speaking, you should be able to put a keyword in there and get up what you're looking for, as we were able to do with medication. So that is the website where you can go and search for the different activities. These are the categories that the activities fall in, and you can see these are really processes, right? Or they are aspects, if you will, of practice that have been found through research, through development, through the establishment very, very much of the patient-centered medical home model to support high-quality outcomes and good management of patient populations. So health equity, is one category. Engaging our patients, beneficiary engagement, behavioral and mental health, care coordination, expanded practice access, emergency response, population management, and patient safety. Those are the categories that the different activities fall within. The way they're weighted is as follows. High-weighted items, so the 14 high-weighted activities are worth 40 points, and medium-weighted activities are worth 20 points if any one of the following is true. If your practice has less than 15 clinicians, then a high-weighted activity is worth 40 points, and a medium-weighted activity is worth 20 points. If your practice is located in a rural zip code, or if you're located in the health professional shortage area, or if you are a non-patient-facing eligible clinician, so a clinician who doesn't really interact with patients, maybe a pathologist who works in the lab and never has access to a patient. For any of those situations, 40 points for a high weight, 20 points for a medium weight. If your practice has greater than 15 physicians or clinicians, and doesn't meet any of those other three criteria, then a high-weighted activity is worth 20 points and a medium-weighted activity is worth 10 points. So the size and or location of your practice does have something to do with how many points you can earn per activity. Regardless of the size of your practice, however, the maximum number of points available for this category is 40. So that's going to be our denominator no matter what. There are no bonus points available in the improvement activities category, although there are some improvement activities that will give you bonus points in the advancing care information category. We'll look at that. What are some special considerations? So there are certain situations where people will be participating in MIPS because they're not part of an advanced alternative payment model, but yet they are participating in some other structured program that is basically going to give them credit and points in this category. The following participants get full credit for the category, automatically get 40 points. If you are in a certified patient-centered medical home, if your practice is a certified PCMH, you automatically get 40 points, you're good. If you have a comparable specialty practice designation, so you're not a primary care, therefore not a patient-centered medical home, but you are a specialty that has a comparable designation and certification, you would get the 40 points. If you are in an alternative payment model that's designated as a medical home model, so it might not be an advanced alternative payment model, it's not one that gets you out of MIPS, gets you the get out of MIPS free card, but it is still an alternative payment model designated as a medical home, you would automatically get the 40 points. Also, Medicare Shared Savings Programs, or MSSP ACOs in Track 1, and if you're in an MSSP ACO, you're either in Track 1, Track 2, or Track 3. Most of the ones in our area are Track 1. Or if you're in the oncology care model, you automatically receive points based on the requirements of those models. So, for example, all current APMs earn full credit just because you already have to do things within that model to be considered fully participating and certified in that model. And those same things count for these activities. So you don't have to do additional activities. It just counts. You get the full credit. And you get at least half credit for the IA category if you're in one of the future alternative payment models that isn't actually on the books yet. The ones we're most concerned about are the MSSP ACO Track 1. If you're a member of those, of a MSSP ACO Track 1, you will get full credit this year. There are other things that you may already be participating in that will give you either full or partial credit under this particular category. There are several projects that are offered through CMS grants, including TCPI and participation in HealthVisions Delmarva, or some other programs that Quality Insights or Health Quality Innovators in Maryland, the Quinn QIOs, run. If you participate in any of these projects, you will earn points during your school. You will earn points for your IA score. Examples include If you are referring patients with diabetes to the diabetes self-management classes that are being coordinated through the QuinnQIO, that gives you points. Receiving education about antibiotic stewardship through the QuinnQIO, that gives you points. Here's the big one for us. If you participate in TCPI, so if you are an active participant in the HealthVisions Delmarva PTN, you get full points. You get one high, that's a high weighted activity. If you report your high blood pressure outcome measures through the Million Hearts program through the QuinnQIO, that is eligible for points. And then also adult immunization rates and wellness visits programs that are provided through the QuinnQIO. If you are participating in any of those programs, you earn points in this category, so you don't have to do anything additional. How's the score calculated? This is a pretty easy one. You take the points that you earn on activities and you divide it by 40, and that will give you your score. So 40 is the maximum points always, and then you're going to add up how many points you achieve. So let's give you an example of that, try to make that real. Let's say we have our 3-clinician practice who's reporting as a group. This is the same 3-clinician practice we used in our example last week when we talked about quality measures. So this practice is participating in the TCPI program as a member of HealthVisions Delmarva PTN. Because the practice has less than 15 clinicians, this high-weighted activity counts for 40 points. So TCPI participation is a high-weighted activity. They have less than 15 clinicians, so it becomes worth 40 points. The practice completes all TCPI-directed activities, including assessment and reassessment, creating a transformation vision, choosing quality metrics, reporting data quality to the PTN, and working on projects to advance through the TCPI phase aims. That's important because you're going to attest to these activities, right? So in the first quarter of next year, you're going to go through one of the methods that are going to be provided for attestation, and you're going to say, I attest to participating in the HealthVisions Delmarva PTN. We also, of course, because we enrolled everybody with their NPI numbers and TIN numbers, we have that on record. So it can be cross-checked and verified. And so we do need to reinforce that practices involved with the PTN need to really participate in the activities of the PTN, similar to any of the projects that you might do. Now, you're not going to be asked to submit paperwork or records or minutes of meetings or anything like that unless you would happen to be audited. And of course, CMS does reserve the right to audit a portion of participants in their programs every year. But you do have to be able to attest that you're following through with all the activities. So this 3-clinician practice participating in the PTN got 40 points for participating in the PTN. We divide that by the 40 maximum points, and they end up with an improvement activity score of 100 points. It's a pretty simple calculation. Now we're going to continue to build our MIPS final score. If you were with us last week, you know that we had a scenario where we ended up with a score of 95 for quality. We multiplied it by the 60% weight for the quality category, and we ended up with a component score of 57 for our final MIPS score. In improvement activities, based on the example we just gave, remember the weight of this category is 15%. Our score was 100. We got 40 out of 40 points. We multiply that by 15%, and that gives us 15 points in the improvement category. We add those two up, and so far, our test or our example practice has a final score of 72 out of 100 points for MIPS. Next week, we'll talk about advancing care information. We'll add the score in those categories and come up with a final MIPS score for this practice. I did want to give you one other example in this category because remember I told you the size of the practice can change the points that you can earn for different activities. So let's say we have a different practice here, a 25 clinician practice who's reporting as a group. This practice also participates in TCPI, but because the practice has more than 15 clinicians, this high weight activity only counts for 20 points for them. So same activity, but now they're only getting 20 points for it because they're a larger practice, and that's just the way they made the rule. The practice completes all their activities, is an active participant with the PTN, And more importantly, one of the projects the practice works on with the PTN is implementation of a patient satisfaction survey and the process for follow-up and action on the findings of that survey. So for this practice, their TCPI PTN participation gives them 20 points. That patient engagement project would give them another 20 points, and so they would end up still with a total of 40 points, because now they're not only counting their PTN participation, but the activity that was done with the PTN. We get 40 total points, we divide it by the maximum, and they too get 100 improvement activities score. So depending on size of the practice, just participating in TCPI could get you over the hump, or participating in TCPI and doing a project that falls onto the list of acceptable projects and changes in practice will get you over that threshold to get 100%. Okay, so how do we submit? Similar to the quality measures, there are multiple ways. All of them are attestation. We don't have a lot of detailed information on the first one of just attestation, which would be attesting at a CMS-provided portal or link. As they develop that reporting mechanism, we'll get you more information. But qualified clinical data registries, qualified registries, and EHR vendors also, those who are capable of reporting your quality measures, will also have an avenue for you to use in their system to attest to the activities that you have done. And it's a simple attestation. All right. So what measures should we pick? What are the things that you should consider when picking measures? There was a lot of detail to this last week because there's, I think, a lot more to think about truly when you're looking at your quality measures. But for your improvement activity measures, there's really only a few things that you want to think about. First of all, high weight activities. There are 14 high weight activities, and they're going to give you the greatest number of points for completing that activity compared to a medium weight activity. So one of the things that we would certainly suggest is that you consider activities in the high weight category because it's going to allow you to more easily and more quickly, if you will, reach the threshold of a score of 100 in this category. You can see that I highlighted in the middle the TCPI participation is one of those high weighted activities, but there are others, as you can see, engagement of new Medicaid patients and follow-up. And if you go to that QPP website that we were doing the search on before, it will describe for you what that means. What does it mean to do that project? Implementation of co-located PCP and mental health services is another one. If we go a little further down the list, providing 24/7 access to eligible clinicians who have real-time access to the patient's medical records, so not just having an answering service that's vetting calls, but actually having clinicians have the ability to talk with patients 24/7 and have their records available to do that. Participation in a systemic anticoagulation program like those that are offered throughout the states with a lot of state projects, or even use of a qualified clinical data registry for feedback reports that incorporate population health data. So you can go out to the website, you can look at for just high weighted activities, and it will give you a description of each of these. Another thing to consider is bonus points. So there are no bonus points in this category. However, as I said previously, there are some activities that will give you bonus points in another category, and that's the advancing care information category, formerly meaningful use. So this list of activities also provide for bonus points in the ACI category. And I highlighted the the four high scoring improvement activities that also will give you bonus points in ACI. And you can see that those are implementation of an integrated patient-centered behavioral health model, that 24/7 access, anticoagulation management improvements, or glycemic management services. So all four of those would not only be high weighted, but they also would give you bonus points for advancing care information. So that's another thing to think about. That can help you with a score in another category. And then finally, your assessment. So for those of you that are participating with the PTN, we do an assessment with you, the TCPI assessment. It's called the PAT 2.0, and I know this is pretty tiny and a little hard to read, and do apologize for that. I was actually going through it this morning and thought really should have broken that up into a couple of slides. But I can talk you through it and explain what we're trying to get at here. Your TCPI practice assessment can serve as a roadmap to selecting improvement activities that are appropriate to your practice because they are important for moving through the phases of TCPI. They are important for improving our interaction and care of patients, and they are high-weighted activities for the MIPS program. So if we look here under patient and family engagement, this one, practice as a formal approach to obtaining patient and family feedback and incorporating this into the QI system, as well as the strategic and operational decisions made by the practice. So this one ties directly to one of the weighted measures that we looked at before, which was patient engagement. So there's really a one-to-one tie between this scored activity in TCPI and the requirements of the MIPS system. There's a lot of alignment within the system that way. Practicing as a community partner. Practice links patients with appropriate community resources to facilitate referrals. There are a number of activities, both medium and high-weighted activities, that have to do with how our practices interact with other services in the community. That 24/7 item, enhanced access, this is a scored item for TCPI, that the practice has a mechanism in place for patients to access their care team 24/7. We just talked about the fact that not only is that a high-weighted activity, it's one that would give you bonus points in the ACI category. So you can see that there are a number of areas where there's tremendous overlap between the assessment we do with you as the PTN and the TCPI phases and the high-weighted measures that you can pick in MIPS for scoring. So now it's time for our next polling question.
Okay, our last one question is, after listening today, I know where I'd like to focus my improvement activities. I have some idea of where I'd like to focus my improvement activities, or I still need help identifying where I should focus my improvement activities. I'm going to go ahead and close that now, and I'll share with results. With 36 saying that they know where they'd like to focus their improvement activities, 52 say they have somewhat of an idea, and 12% still needing help identifying.
Okay. Well, one of the things that your practice advisor can do with you is sit down and kind of go through this. And I think that that's a really good use of your time with your practice advisor during your regular meetings, is to really sit down and look at the site, look at the QPP site, and talk about which things on the site really match up with your assessment. So I'm glad that 36% know what they're going to do. And I know that we can be of help with the rest of you with helping you to identify what activities are going to be helpful to your practice. Some summary bullet points. Clinicians in practices of less than 15 must attest to at least one high or two medium activities to equal their 40 points, while those in practices where 15 or more eligible clinicians must attest to at least two high or four medium activities. So it's important to know how large your practice is when you're reporting, especially in the group reporting. Participation in TCPI as a member of HealthVisions Delmarva PTN is considered one high activity. And so that gives those of you who are enrolled a head start and a step up in complying with this category. There are additional programs offered by the Quinn QIOs in your state that can provide points in the IA category, and that was available listed on one of our slides. You can refer back to that. Activities focus on processes within the practice that support quality outcomes, patient engagement, care coordination, population health, and efficiency. Just to drive home the point that these activities represent important attributes of successful practices in a patient-centered and value-based healthcare system. That's the reason that this was added to the quality measures to meaningful use, because we do understand that it's the process that's going to help us get to high outcome scores with our patients, or will help us get to more meaningful use of our electronic health records. And so these are important attributes of successful practices in the new world of value-based healthcare. Activities will be attested to through a registry, QCDR, certified EHR, or a CMS-provided website. More information to follow on the CMS website. Activities must be completed for a minimum of 90 days to count towards the IA score. So you do have to implement and do the activities for 90 days. Again, the intent of that is that even if you aren't able to, for the first 2/3 of the year, do any of these activities, if you can in the last quarter implement something, then it counts. It really isn't intended to be, I'll do it for 90 days and then I'll quit. Activities can be reported as a group or individually, but remember, you have to pick the same way to report your quality measures, your improvement activities, and your ACI measures. Activities chosen should reflect aspects of care important to your practice. And do let that PAT 2.0 assessment, the assessment that your PTN practice advisor did with you, do let that guide your selection of activities. And then finally, certain activities also provide points towards the advancing care information scoring component. So you might want to be mindful of that as you're picking activities, to look at activities that might also give you points in that category. So I think that we can open it up for questions now, Kaylin.
Okay, you're more than welcome to use the raise hand icon if you'd like to speak with Cindy live. But Cindy, I do have a couple questions that came through during the presentation.
Okay.
I think most of them were answered, but we'll revisit them. One of them was, I was unable to find where and if it was necessary to notify CMS which PACE to choose, if we were submitting as an individual or a group, and is there a place that they can go enter TIN and choose these options, and how would CMS know what they were doing?
Okay, so yeah, there is no requirement for you to register, and there's no mechanism for you to register. So the way CMS will tell is by you doing it. Let me say that the only exception to that is if you're going to use, if you're reporting as a group, CAPS survey results, that you do have to register. And if you're going to use the GPRO site to report as a group using the CMS web interface, and you aren't already a registered user, you would have to register to use that site. I can add the information. There was a slide on that last week, but I can add that information back into this presentation so that when we send out our follow-up, we'll send that as an attachment with that. So that's the only requirement to register. Otherwise, you don't register. You're simply going to submit. So if you submit one measure and that's what they get, then they'll know that you were only testing the PACE and submitting one measure. If you submit data for 90 days, then they'll know that that's what you were doing. If you submitted as a group, they'll know that you were submitting as a group. So it's really just based on how you actually finally submit your data, and that won't occur until the first quarter of next year. So the only exception to that part is if you're submitting claims data through claims data, and you can't attest through claims data. That would only apply to quality measures, the ones we talked about last week. If you're submitting quality measures through claims data, you kind of need to be doing that now because your claims are going in, and so that's sort of a real-time thing. They're only going to look for claims data from you if they don't get registry data or GPRO data or QCDR data from you or EHR data. It's sort of the default, if you will. So if you don't submit data in the first quarter of next year through one of those other intentional submission paths, if you will, then they're going to look at your claims data and try to determine, they'll determine from there which quality measures you sent information in on your claims. So I hope that answers the question.
Okay, and then the next question that came through was, is the group reporting done by organizational NPI and reassigned TIN?
Okay, group reporting is by TIN and the individual NPIs that are assigned to that TIN. So when you report as a group, you're basically reporting under your TIN for all of the NPIs assigned to that TIN.
Okay. You answered this one as well, but if a practice is enrolled in TCPI, then does it have to do anything else? Do they have to do anything else to earn their 40 points, or is the enrollment not adequate in itself? And then I kind of added on to that is what is considered participating.
Okay, so if all you did was enroll and you never participate, you don't actually actively engage, then no, that's not enough. So you need to enroll and to participate. So what is participation? Participation means that you have an initial assessment and then a reassessment every 6 months, that you meet regularly with your practice advisor, either in person or virtually, to work on activities that will help you to improve your performance on that assessment and to improve your patient outcomes and your processes within your practice. So you have to be actually actively participating in transformation activities, transforming some aspect of your practice, changing and improving some aspect of your practice. As long as you are routinely engaged with your practice advisor and you are working towards improvement on your assessment and then having those assessments done every 6 months, then that gives you 40 points if you're a small practice, and that's all you need. You don't have to do anything above and beyond that. If you're a large practice, then again, that's all you need, because the projects you would be working on with them would qualify to get you the additional points that you need.
Do you have to submit your PIA via the same method as your quality measures?
So do you have to? So if you're doing your quality measures through a registry, would you have to attest to your IA through that registry? I don't know that is the case, and I'll validate that. I mean, I know that when you report your quality measures, you have to send all of them in through the same method. But you may be able to just go out to the CMS website and attest to your improvement activities. I guess the thing would be, if you are submitting your quality measures through a registry, it's probably going to be easiest for you to simply attest to both your meaningful use, your advancing care information and your improvement activities through that same submission. So it might be easier to report them all the same way. I just don't know that it's required.
Okay. If a practice starts reporting as a group, can they later change it to individuals or vice versa?
Well, every year you can make the decision on what you want to do. But you're going to submit your data basically once a year. And it's going to happen in the first quarter of next year. You'll submit all your data for 2017. So you're either going to do a group or individual for 2017, and then you might decide, well, for 2018 we would rather do it the other way. You can do that, but you really, there's not really a mechanism for changing it in the middle of a year.
Okay. Here's another question. I'm really confused about how to submit all categories via a QCDR. For example, if we are to attest to a performance improvement activity, how would we do this through QCDR? Okay.
So to be either a certified registry or a QCDR, those registries have to meet certain requirements from CMS to be qualified and certified, if you will. One of the things they will have to be able to do for 2017 is to provide you with an opportunity to attest to these measures. So they're going to have to add that mechanism. They're going to add a field or add an app or add a link or a selection or a tab or whatever we want to call it, but they're going to have to add the ability for you to do that. It doesn't exist now because it doesn't exist yet, but it does need to exist for your reporting when you report that in the first quarter of 2018 for your 2017 activities.
Can you give us an example of a high-weight activity for primary care practice?
Sure. There's a lot. So these are all the high-weight activities.
Now, is this for primary and specialty?
This is for primary and specialty, so they're kind of all mixed in the same. The idea of providing 24/7 access to clinicians who have real-time access to the patient medical record is certainly something that could work for primary care. It would be a matter of ensuring that you have clinicians on call and that those clinicians have access to your electronic health record from wherever they are. So that's absolutely something that could work in primary care. Anticoagulation management programs certainly apply to physicians in primary care who are managing patients with AFib, for example, or glycemic management services for those patients who have diabetes. And so implementing programs specifically aimed at one of those two medical conditions. 24/7. I like that one. If you participate in a 60-day or greater effort to support domestic or international humanitarian needs, in other words, if you do a mission, you get credit for that, which is kind of cool. Co-locating PCP and mental health services within a practice. A lot of FQHCs do that. Or implementing an integrated model of patient-centered behavioral health. Creating a situation that's collaborative with a mental health provider in your area where you're doing either virtual visits or they're supporting your services. So almost any of those could be appropriate for a primary care practice.
Great. And the last question that's come through our question in our taskbar is, improvement activity states that a minimum of 90 days. Does that mean that if we choose TCPI participation as an improvement activity, our practice can work with our practice advisors for 90 days and then attest to this measure?
No. So this goes back to the idea of the 90 days isn't about, okay, I'm going to do this for 90 days and then I'm done, then I don't have to do it anymore for another year, and then I'll do it for 90 days and I don't have to do it for another year. The 90-day requirement is really only in there to basically say to you, we want you to do this all year, but if you just can't get started until the last quarter, if you at least do it for the last quarter of the year for 90 days, we'll give you credit for it. All of the improvement activities are expected to be ongoing. Once you start them, they should continue till forever or until the natural end of that program. TCPI would fall in that category. It's a 4-year program. It ends at the end of 4 years or when a practice graduates into phase 5 and has completed all of the requirements of the assessment and you have scored a 3 on every item of the assessment. So no, it's not meant to be you get to do it for 90 days, then I don't do it, and then next year I'll do something else for 90 days, and then I don't do it anymore. If you really look at these activities, it's about making a permanent improvement to your practice and keeping that going forward.
Okay, we actually have a couple more that have come through.
Okay.
And actually, let's see. Well, I'll go ahead and read them. And so, is what you just said about QCD or having to have the ability for you to report all components of MIPS at the same, the same for a certified EHR? In other words, will a certified EHR have to provide you with a method to submit your quality measures, ACI, and PI activities? Are they allowed, this is kind of complex, you want me to continue? Are they allowed to charge you more for the facility? And then we'll answer that, and then I have another one.
Okay, so I put up back on the screen the submission methods, okay? By regulation, these are the methods that will be available to practices to attest. So CMS is saying you will be able to attest through an attestation portal that they will provide, your QCD or your qualified registry or your EHR vendor, your certified EHR vendor. So that's saying to us as practices, right, you will have the ability to do this way. It's also saying to those registries and those EHR vendors, you will have to provide the mechanism for them to do that this way. Now, can they charge you more? I don't know. You know, the one thing that has not been tremendously well regulated in this entire process of EHR is what vendors can and cannot charge for. I don't know if they can charge you more in order to do that. If they can, again, I'm checking to see if you have to attest using the same mechanism that you sent your quality measures in with. If you don't have to attest that way and your EHR vendor wants to charge you more to do that, then you could just go use the CMS website to attest for free. So I think that there's a few questions we need to answer out there. I seriously doubt that they have been forbidden from charging more to do that, but I honestly don't know how that will all shake out. So,
wow, keep coming in. This is great. Can you report the same activity multiple years other than TCPI? So if you pick patient engagement and you are continuing what you put in place, can you just claim it again, or do you have to show something new?
You can just claim it again. You can just claim it again as long as you keep doing it forever. Well, you know, or each year that you continue to do it. Maybe not forever, but each year you continue to do it. Yeah.
And one of our attendees did just say they just found out that their EHR is going to charge them for a MIPS dashboard, and they have not charged them in the past for a MU dashboard. So I think it depends on your EHR.
It does depend on your EHR vendor. I'm sorry that that's the case, but it really does, and it's kind of unfortunate. But you know, but I want to say that I think that that's something that you really do have to kind of do a little bit of a business case analysis of. You know, I don't know how much they want to charge you, but it is really important that you be able, especially on your quality measures, to monitor in real time how you're performing on those measures. So that MIPS dashboard will be vitally important to you, because if you don't have that dashboard, you don't know how you're doing for real. And if you don't really know how you're doing until the end of the year when it's too late to fix it, you could get a 4% decrease in your Medicare reimbursement and your fee schedule, and you got to weigh that. You got to calculate what's the potential risk I have for having a 4% decrease in my Medicare payments. So figure out that dollar amount and compare that to what your EHR vendor wants to charge you. You got to do a little bit of a business case analysis. I go back and say I really wish that that wasn't the case, that we were dealing with this, but I know that it is something that some of you are truly dealing with your EHRs.
Okay, I don't have any other questions. I want to thank everyone for participating today. Just as a reminder, this recording will be uploaded to our YouTube channel hopefully later today. And I'm going to try as well to get out all of the answers to the questions that you asked again into a tangible format via email. As well, you can download the slide deck from today in your handouts. And I hope everyone has a great day. Thank you, Cindy.
Well, you know, just a couple other things. I did want to point out that in addition on the YouTube site, I did give you a list of other related PowerPoints or presentations, webinars that are out there on YouTube. And that one in the middle, Why Should I Transform My Practice? What's in it for me? It's truly related to this, because these are all transformation activities. And so I think that it's a great webinar that was done by a physician, Carol Greenlee, one of our national faculty, talking about how doing these activities truly improved her ability to care for her patients and improved her happiness in practicing medicine. So I think that it's a great webinar to share with all of your staff if you didn't participate in that one in real time. And then, of course, our Focus PDSA one. The registration link for next week's module on advancing care information is also part of the PowerPoint. And we did questions already.
Yeah, and I'll send a an invite to next week's webinar as well. So again, thank everyone for attending today, and Cindy, thank you for presenting.
Thank you.